action items, Department of Rehabilitation, CPT grant award.
We applied for a grant to with rehabilitation for our transition partnership program, and we have been awarded that grant for 2012 through 2014. This would bring $173,166 to the WESELPA. That money is used for 2 case transition technician specialists and to support their salary, as well as some of the monies go to support the individual classroom for supplies, field trips, and curriculum. And basically, we also have a commitment to put in time as an in-kind match in order to obtain this grant, and so we do that through a variety of WESELPA staff as well as our classroom staff. So basically recommending that we approve the contract and allow myself and Catalina to be able to sign any contract agreements and billings.
Okay, need a motion? So moved. Second, Mr. Joseph. Second by Carr. Any other questions, comments? All in favor? Aye. Any opposed? Motion carried unanimously. Item F2, Oversight Committee, Regional Program for Service Model, SBCSS, Joe?
And our oversight committee did meet a number of times to look at the backup information that you actually didn't see today in the development of the 2 models being brought forward. And at this time, we're asking for approval to be able to move forward in calculating the fee for service for next year based on these models. Obviously, one of the significant changes is in the county program, because there are additional types of programs having separate fees, and Janet indicated the low incidence itinerant as one. Also, we in the past didn't have a separate fee for preschool and special day class, preschool and special day class K-12. So that is different as well. And that's been an issue that was part of the FICNET study, actually. And then we really didn't, we in the past had just used the fee for service that county calculated for our regional provider programs, which generally ended up in you overpaying those programs and then getting a return at the end of the year. And I don't know about you, but I don't like to prepay and tie up my money, and especially with cash being, very short in districts, it's best if you kind of have that on hand. And so I think Phil did a really outstanding job of dealing with the thorny issue of how do you separate out a very specialized program within the district programs and the types of students they serve. That is a change totally in how we looked at fee for service.
Okay, I need a motion.
Motion to approve.
Again. Second by Mr. Joseph. Any comments, questions?
Well, I appreciate all the work that the committee has done. Have we looked at how, when we apply this model, how that will affect the districts?
There were no simulations done. It would really depend on each district, because it would affect the high school district probably differently, because the preschool special day class, what you were paying for those kids has gone down quite a bit. Whereas the high school's not going to see any benefit of that. Although the special day class overall went down, but certainly the related services went up. So it's realigning the costs, I don't know how it would affect each district. We'd really have to take a look at that.
Determine the rates, and then turn around and put it in the distribution cost and compare current year to what was supposed to be.
So I think the answer to the question is no. Not this time. All right.
You are one of the ones that reduced significantly, though, in both non-public school and regional provider programs. So, you know, and then that's why there's no right number. Being a very small district, you can't serve all your kids in district.
Right, and that's the information I'm lacking. If I know that.
So we could bring that information, kind of a model without an approved rate, but a projected rate,
We could do it on this, actually.
a simulated rate next time. And then, that would be April, and then in May, we can approve the rate. So is that for everybody else's budgeting purposes?
We had another comment.
We're being asked to approve a model, not as a rate.
Right.
Right. Although I think Janet's pretty confident the direction of change in the rates.
It's aligning them.
So we do have a motion and a second on the floor to approve the model. So I'm going to call for the question, all in favor? Aye. And any opposed? 2 nay. Any abstentions? So it looks like we have approval conceptually for the model. However, I think prior to the this council acting on, we need to see this broken out by district.
And as Joe mentioned, I think we can do over with Carolina to take these rates, knowing that this is current year, and which actually works well because current year is under the old formula. So we'll compare this with the old formula, district by district. The difference being is is I guess
Right, there'll be a timeline, a little bit of a timeline issue. Once both of the provider programs actually provide us with the rate that they're projecting and they're going to be requesting the rate approved. Once we get those numbers, we have our fee for service which are on those timelines now for this year, we'll be able to put that information into the model so we can see what the direct impact will be to each district. So it's kind of a two-step, but I don't anticipate that I have all the information from county and or OMSD by the time we meet next month, that we could always take a look at the rate and see where we're going on that, and then go ahead and look at the model. If I have enough time ahead of time to get a little bit of advance notification, I can go ahead and plug those, the change of rates onto the model.
Presentation of what we would expect that we would be real. As everyone else in here does have a very significant concern about the impact of special ed.
Right, and part of that, why we have the rates normally determined this month and or next month is so that we can have timely information to pass on to districts, so the districts can go ahead and build their budgets. So it's all kind of a financial issue, but
But at this point, you're having to get it.
And again, that's just a simulation, that's not actual, but it'll give you a sense of things. Yeah, absolutely. No, I appreciate your concern. Absolutely. Okay, we're going to move on to G. Are there any future agenda items? Dr. Brennan?
I would just like to at least agendize or make the recommendation to agendize a conversation for the council in regards to perhaps something around the topic of communication protocols, particularly the role of the council, perhaps the designated role in regards to how we respond to communication that is presented to the council. Just, at least for me, it's unclarity.
Good idea.
And may I offer a second one as well? And maybe this could possibly be through the recommendation from the director or the staff, just to look at any possible addendums to the local plan, particularly the signature elements, anything that kind of keeps the local plan current as far as signatures and things that would be relevant to this current council.
Thank you, Dr.
I
Hammond.
understand. Do signatures need to be updated annually, or can they just, once the plan has been approved, whichever group did that, they sign off, and then the program, the plan moves forward, obviously, unless amendments are made.
Yeah, or if there's other places that make more relevance, maybe if there's ed codes or new assembly bills, just to keep the plan current and compliant.
As recommended in here, amendments can be made during the budgeting process. Certainly, the superintendent's council can present those under precedent.
John has to be our historian.
But it's like, the only signature I see is Sean.
It's all your fault.
Can I make a nomination for the